Up to 12 million people die on the roads, die as a result of road traffic accidents annually. That's not a welcoming thing, to the point where the World Health Organization sees this as a public health problem. So it goes way beyond hospital care. But then, a little accident might not be much, but it may be that you are unable to work. If your arm is broken and you're a carpenter, or you're a surgeon, or you're just a housewife who takes care of her children, those are the costs we tend to forget, the cost of not being able to produce. If your car gets into an accident and you're the doctor who works in Sauters, how do you get to work tomorrow morning? Or you're a teacher from Sauters coming to St. George's, how do you get to work tomorrow morning? So those are the costs. It's not just, just going to have a plaster price and I can mosey around. It goes way beyond that.
The major causes of accidents on our road is actually speeding, also the use of alcohol or drugs. Now the law speaks to the nature condition and the use of a road at any particular time. The use of the road taking into consideration the amount of people that is using the road at the time. The nature of the road, whether the road is narrow, whether the road is winding. So if the road is narrow where two vehicles cannot safely pass each other, then you need to reduce your speed.
It goes to the point where we have to ensure that drunk driving is not allowed. Driving under the influence of anything that disenhances our capacity to recognize danger. It may not be another driver. It may just be a wet road, or a road that has had an oil spill, or a road that has gravel or something that causes a slid. It goes beyond that. Are we prepared to be good drivers? Are we prepared? Can we read and write? Do we understand the road code? Are we employing the road code? So there are other things that are not necessarily directly related to what it costs the health, but what it costs to the entire country and the entire health system, because people are not really prepared.
Persons are not complying to traffic signs, and that is a contributing factor to accidents. In other words, they are not obeying indications, also indications given by officers, even on the point. When officers are calling traffic on the point, the officer will stop persons and they will still drive up. That is an offense. So, and that can cause accidents also because persons are coming from the other direction. We are also having an increase in hit-and-run accidents. In that I mean persons are getting involved in accidents and are not stopping.
We are asking that people become responsible drivers by taking precautions. Make sure your vision is good. Can you see? Have you had a medical? Does your doctor tell you that, yes, your vision is good? Those are the things that we have to look for to ensure that the rest of the system is not disrupted. Because at the end of the day, if there's an accident, big, small, or indifferent, it is going to cause, it's going to affect how the rest of the system in the emergency room, in the clinics, wherever you are, work. And above all, it affects how our families work. It affects the quality of life that we'd have as families, as individuals, whoever we are.